COVID-19 live town hall, your health and safely reopening our economy weekly update. My name is Terry, and I'll be your host tonight. Also with us this afternoon are your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layden, live by video. Joining us this afternoon on the phone are Dr. John Douglas and Melissa Saeger from the Tri-County Health Department. As a reminder, you can watch and listen at douglas.co.us/town hall. We look forward to receiving as many of your questions as we can on this live event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They will ask for your name and where you're calling from, and they'll make a note of it. Then the next time you hear your name, you'll be live on the call and you'll be able to ask your question directly. Or if you're watching online, you can send your question using the website. We'd first like to set the stage for tonight's discussion. Douglas County began a phased-in reopening of the economy beginning April 27th, consistent with Governor Polis's statewide new safer at home orders that began that day. Since then, we have been working with the local Douglas County business community and your Tri-County Health Department and many other community leaders on plans to safely and responsibly reopen our economy. This is Douglas County's 9th live town hall since March 24th. On behalf of Douglas County, thank you for joining us this afternoon. We're glad you're here and look forward to hearing your questions. Let's begin with a few words from your Board of County Commissioners. Commissioner Partridge, let's start with you.
Thank you, Terry, and good afternoon, everyone, and welcome to, as Terry said, our 9th town hall, which we continue to do to be able to keep you informed and know what is on your mind. And whether you are been here just recent, from the last few years, 25 years, or you are one of the families that began Douglas County back in the late 1800s, we welcome you and look forward to hearing from you tonight. I just want to make note that we are also very pleased again to have Dr. Douglas and Ms. Saeger joining us from Tri-County to help keep you informed and answer your questions. Thank you, Terry.
Okay, Commissioner Thomas, let's hear from you.
Thank you, Terry. I'd like to thank everybody out in audience land who's listening to us. This certainly has been a very unusual and unprecedented time for all of us, but I'm impressed with the questions that have been emailed to the commissioners and how people really are just looking for the way to move forward to get back to their lives and away from this abnormal life that we've been living. And it's just important for you to know that we've been working closely with Tri-County Health on variances, and we think that we are close to getting better, more things open. So just continue to wait because we're working to get that done for you. Thank you, Terry.
And finally, Commissioner Layden.
Thank you, Terry, and thank you to my colleagues and certainly to everyone out there in Douglas County that's spending a little time with us tonight. Wow, 9 live town halls. I think this is really a wonderful opportunity to just connect with you face to face, hear your questions, hear what's on your mind. No doubt, so much happening in our world right now, and we know that you have questions and you have concerns. I always like to say that we work for you, not the other way around. So we're glad that you're putting us to work, holding us accountable, and asking questions that are on your mind. So looking forward to your comments tonight. Thank you, Terry.
Okay, tonight your commissioners, as well as Dr. John Douglas and Melissa Saeger from the Tri-County Health Department, will be happy to receive your questions and provide you with updates on exactly what is being done to safely reopen our economy. We look forward to answering as many of your questions as we can on this live event. And speaking of being safe, we encourage everyone to continue demonstrating the public health recommendations found in the state orders, including following social distancing guidelines, frequent hand washing, and especially if you're over the age of 65 or have chronic health issues, staying at home as much as possible to avoid possible exposure to COVID-19. If you're just joining us, to ask a question, you can press *3 on your phone or send your questions through the website. Let's go next to Dr. John Douglas as he shares the most recent Douglas County COVID-19 public health data. The good news that creates the conditions for Douglas County to continue moving forward toward reopening our economy. Dr. Douglas?
Thanks very much. Great to be with you all. I'm not sure I've been on all 9 town halls, although I've been on many of them, but this is one of my favorite groups to be with, so I'm delighted to be with you this evening. I'm particularly delighted because public health often involves talking about problems in communities and sharing what one might consider bad news. So it's great that the good news that has been occurring in Douglas County around various metrics or parameters about the COVID epidemic continue to be impressive and be optimistic. As mentioned earlier, Douglas County transitioned from the more or less kind of stay in your home under most circumstances, stay at home order to the safer at home order over a month ago. And it was able to make that transition because really unique among the counties in the metro area, its statistics in terms of numbers of cases, number of hospitalizations were low enough that we felt that it was safe for the county to do so. The really impressive thing is how those numbers have continued to remain low. For example, we've only had 6 hospitalizations in the last week. You know, in some ways that's 6 too many, but when one compares it to what other counties have experienced, and certainly even what Douglas County experienced previously, that's fantastic news. Likewise, while we do see some days where we see more case numbers, that at least right now is almost certainly because we're doing more testing. More testing is actually good news that we can give more people who have gotten sick with COVID a chance to know that, so we can help them take measures to prevent exposure to other people. That's called isolation. It also gives us an opportunity to talk to them, and if they are willing to share information with us about where they've been and who they've come into contact with, we now have an opportunity to do what you may have been hearing more and more about, contact notification. This is all handled both confidentially as well as voluntarily, I would emphasize. And it's really done as a service for both the individual who's infected and those who've been exposed, so they themselves can take precautions, with those precautions including testing. So we're excited that the various measures that will allow us to further contain the epidemic are coming into shape. We really appreciate the support of the Douglas County Commissioners in helping Tri-County develop more robust contact notification capacity. We're training our first new group of volunteers this week to enhance our workforce, and are looking forward to hiring contract staff to help us in even greater numbers in the next 1 to 2 weeks to come. I do want to say that part of the reason that we are doing the kind of things we're doing is that we want the news to stay good. And we want the sort of things that were mentioned a few minutes ago to help us maintain safety. Social distancing as much as possible. Frequent hand hygiene with hand washing and hand washing. Or rather hand sanitizer and hand washing. If you're in one of the vulnerable groups, people over the age of 65 or people with underlying disease, sort of keeping a low profile, meaning staying at home most of the time, avoiding contact with others unless it can be done very safely, is important for your protection, but also really the community's protection. And then finally, we're strong believers in the value of face coverings or face masks. They may not protect you from getting infection, but they seem to play an important role in preventing transmission of infection. We had an opportunity the other day to get an updated assessment by the Colorado School of Public Health, a real local resource. They've been doing transmission dynamic modeling for the state of Colorado. And they're telling us that, look, if we can keep doing the kind of social distancing we're doing, and especially if those of us who are vulnerable can stay at home and avoid getting infected, our chances of surviving this without a big new surge, we talk about that second wave, are actually quite good. But we all have to practice that personal responsibility, that vigilance, and take those precautions to prevent that from happening. And then finally, I want to note that there will be a new public health order coming out tomorrow This is a statewide order. It allows more opening of churches, more opening of outdoor recreation, personal recreation, which includes pools, parks, youth sporting things that so many of our community members have been chafing at the bit, very understandably, to try to get back to. We're going to have guidelines about how we can begin to get back to that very soon. So that's a very much appreciated as we're beginning summer next step. So thanks very much.
Thank you, Dr. Douglas. Now let's hear from those of you on the website and on the phone. We have many questions coming in by phone and online, and we are looking forward to hear from as many of you as possible tonight. Just a quick reminder, to ask a question, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. Okay, let's go to an online question for Dr. Douglas from Patsy. Patsy asks, with pools opening and daycares opening, what's the risk level for grandparents to see grandchildren?
Patsy, really good question. I'm a grandparent, so it's personally relevant to me as well as many of the rest of us grandparents around the community. In all honesty, the risk to us of being in contact with our grandchildren is probably going to go up a little bit as they get back to more normal lives. So we're going to have to continue to be careful about that. Now, I do think that the guidelines for pools, just like the guidelines for daycare, are really well thought through. And to the extent that they're practiced appropriately, I think the increased risk to our kids and grandkids from being in those settings is probably going to be low. But we're going to have to, frankly, just continue to be vigilant. We're going to have to practice our own social distancing when we're around them. I haven't hugged my grandkids for a couple of months now, and it's really chafing. But I think that's the kind of thing that if they're getting out and enjoying the community, you and I are going to have to continue to be careful about. So be with them. Outdoors is a great place to be with them because that ventilation helps us. Don't forget the face masking and the hand sanitizer. So be with them, laugh with them, share meals with them, but do so in that safe manner.
Okay, our next question is also an online question. This one will go to Melissa from Tri-County Health. This question comes from Jane. It's with Governor Polis' COVID-19 guidance released tomorrow. States at 50% capacity or up to 50 in a primary worship space, whichever is fewer. Is this more strict than Douglas County variants of 50% capacity? And who's got jurisdiction?
Yes, so this is more strict than the Douglas County variant. This is a state requirement, and the Douglas County variant is still in place because we're still under the safer at home requirement. So places of worship can continue to follow that Douglas County guidance regarding places of worship as it relates to the number of folks that you can have in your building.
Okay, thank you. Just a reminder, we're looking forward to answering as many questions about your health and safely reopening our business and economy as possible today. We want to hear from you. To ask a question, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. For the past 5 weeks, many of the questions you have asked during the live town halls have focused on the need to know when activities and venues will reopen. Your commissioners are ready to provide you with updates, progress on safely reopening the Douglas County economy. Commissioner Layden, let's start with you.
Sure. Thank you so much, Terry, for that question. You know, we continue to receive just a dearth of messages and questions from individuals in and around the community. Commissioner Thomas has done a great job of answering a lot of those, as have others. But, you know, specifically around summer-related activities, like pools, playgrounds, we're continuing to get, and then certainly questions about how seniors can still be recognized, perhaps, for graduations in Douglas County. So pleased to share with you that, based upon the wonderful metrics that Dr. Douglas and Melissa Saeger have shared in terms of that marginal decrease in deaths and hospitalizations in Douglas County, this Board of Douglas County Commissioners just submitted through staff another round of variance applications for specific activities. And those include theaters, libraries, playgrounds, bowling alleys, pools, events and cultural venues, team sports, graduations, and then some modification to gathering sizes, and also some additional conversation around the county fair. And so some of this is in progress, some has already been submitted, but no doubt these are really significant questions. I think it's tough to ask suburban parents in and around my district to be at home with kids for 3 months, and then when summer hits, you can't go out to playgrounds or pools. Certainly, we're hearing from the experts, and I would ask Dr. Douglas to help me with this, but our understanding is that coronavirus cannot survive in a pool environment. And so certainly we're requesting that. Now, we did receive some recent conversation from the state about that. I believe Commissioner Thomas may be sharing more on that level with pools. But I wanted to share, for example, theaters is one example of a variance application that we have submitted. Certainly, as we've seen with churches and other venues, if there is appropriate social distancing, hand washing, making sure that there's spacing between seats and a variety of other measures related to capacity, that perhaps theaters and venues of that nature can also be opened safely. So we're looking forward to a response on those applications as well. Thank you, Terry.
Thank you, Commissioner Layden. Commissioner Thomas, would you like to add your comments?
Yes, thank you, Terry. We've been getting lots of emails and we've been monitoring social media to see what people are thinking in Douglas County. And a vast majority of people are ready for things to get open. Every once in a while, we see somebody expressing some concern and maybe even some fear. And I would just like to talk for a quick minute about some numbers off the Tri-County Health Department website and the state's Colorado Department of Public Health environment. So for Douglas County, the 3-day average for hospital admits as of today is 0.3. The 7-day moving average is 0.7. So what's important to remember is that if the 3-day average is lower than the 7-day average, that means that our numbers are declining. And our numbers have been declining in Douglas County since we moved to Safer at Home on April 27th. I'll just mention that the Colorado numbers, the 3-day average is 12. The 7-day average is 15.3. Again, very good numbers for a state of almost 6 million people. So for those who are expressing fear, know that if you follow these directions of if you are older and might have a compromised immune system, wash your hands, keep that social distance. And it's time to keep our lives moving. I'm just going to talk about a couple of things we hear about often, and that's pools and playgrounds. Also, adult and youth sports. Those are all mentioned in the governor's orders that will be out tomorrow. Right now, we understand that pools and playgrounds can open to 50%, and adult and youth sports can be conducted if there's a total of 25 people on a field. So we're going to be watching that order, and if it's something that we think we can do even better, we will be writing a variance on those 3 topics and sending them on to Dr. Douglas. The other items that we're working on right now are private schools. Private schools have come to us and said, we really need to work on how we get open in the fall. And we're working with some private schools to get that done. We've also had a similar conversation with President Ray, David Ray on the school board. And he has a committee working on this. So we probably will be working with the school district as well on a plan to get our schools open in the fall. And the most popular one we get lots of emails about are facials. Estheticians want to go back to work, and I know I've been waiting to get my facial too. And that is something that's being drafted right now, and we hope to get that submitted soon. If you're out there and you have some business or something that has not yet been addressed, please email the county, and we certainly will get that started for you as well. Thank you, Terry.
Thank you, Commissioner Thomas. Commissioner Partridge, take it away.
Thank you, Terry. And what I'd like to talk about is the Douglas County Fair and Rodeo that is held in Castle Rock. That's where our fairgrounds is. And that is supposed to take place July 25th through August 2nd this year. As you know, it's one of the biggest events in the county. It has over a 100-year history, so it's very important to us. We know it's very important to the community. What is so important about this fair is it brings the agricultural Western heritage showcase to the citizens of Douglas County, and it really lets us see and showcase the 4-H FFA programs and projects that the kids are working on, and that many times the parents are greatly involved in. So we know this is a great and important event, and we'll let you tell we have not canceled the fair. Our attitude is a can-do. We will have a fair. We just don't know what it's going to look like. So we are in the process of working on a variance. I think it will be a very complicated one. I've already talked with Tri-County Health. They'll be working with us. We've already had some meetings on this week, and we'll do a walkthrough on Friday. So please know we are very cognizant of the fact it's an important event for Colorado, for Douglas County, and we certainly will make that push, no doubt, to the governor, to CDPHE, to Tri-County, so that you, Douglas County, can enjoy the Douglas County Fair and Rodeo. Thank you, Terry.
Thank you, commissioners, for those updates. Just a reminder to everyone on the phone and online, we're looking forward to answering your questions about safely reopening our economy. We want to hear from you. To ask a question, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. All right, let's take our first caller, our first live caller, Lou from Castle Rock. You're live.
Thank you. I appreciate what all of you have been doing, but I think that one of my problems is that everything that I've heard is, none of it is specific, which doesn't help matters too much. My question is, do you know, or is there any way, have you been following things, that those people who have come down with the virus, do you know how they or where they have attracted it? In other words, are they people who are working, or are they people who have gone to crowded places? Is there any way that you have tracked any of these people?
This is Dr. Douglas. Shall I grab that one?
Yep, go ahead.
Okay. Great question. And what you're actually asking about is the basis of the sort of public health work I mentioned earlier, Lou, where we, anytime somebody tests positive, we do what's called a case investigation. The person who tests positive is a new case of COVID, and we review with them, how do you stay safe? How do you get medical care if you need it? And then let's talk about where you could have gotten it, which reviews the very questions that you ask about. And then let's talk about who could have come into contact with you after you got sick, so that we can take precautions with them. So we do try to drill down, if you will, on both where did you get it, to answer the kind of question you're thinking about, as well as who could you have been exposed to. And your question is really important, because as Douglas County safely opens up in a variety of different areas as a result of the, I'd have to say, very well put together variance requests that the county has been working on, determining if we have any change in the good news is really an important part of staying safe. And determining if we do begin to get new cases, where they're getting them will be an important part of that equation.
Thank you, Dr. Douglas. While we still have you on the call, I've got a couple of other questions from Amy and Todd online. They asked antibody tests to see if you still have the virus, and are they less expensive than a follow-up COVID test? Are they reliable? And is anybody tracking the results of these tests for antibodies?
So this is a package of good questions about antibody tests, which remain an area of great interest and concern. I think if I got them all right, they do vary in cost. Most of them are not covered by health insurance because they're not used as a diagnostic test to determine if somebody actively has COVID or not. So they're often require payment out of pocket. We don't track on the cost of them. My understanding is that they may range from $75, $100, $125, something like that. I think your other question, or rather your second of several, is a really important one, which is the reliability. And this is really a work in progress. Some of the initial data that was reported looked pretty promising, but it was clear we didn't have super comprehensive FDA oversight of the tests themselves. As we've learned more about them, we've learned that their ability to tell you if you've really had it or not is not 100%, and your ability to be reassured you've never had it is also not 100%. And some of the variability may be as low as 60 or 70%. So there are a number of entities that are trying to assess this and compare it to people that have actually known to have COVID or known not to have COVID. And we're looking forward to better clarity from those efforts to really figure out whether what should be a really useful tool is as good as we hope it might be. And at this point, it's not really being tracked on. Those tests are being not reported to us, so we don't really follow up on them in the same way. I think once we get a better test out there, we're going to be really interested to try to track on it, especially if we can do samples that might be somewhat generalizable to the population. So we could say, hey, we think in Douglas County, 6, 7, 10, 15% of people might have already been infected.
Thank you, Dr. Douglas and commissioners. Thanks to all the panelists for this valuable information. We're looking forward to answering as many questions as possible tonight. Again, to ask a question, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. Please stay with us and let's keep the conversation going. At this point, I'd like to offer up our first poll. Have you participated on previous Douglas County live town hall events? Press 1 on your phone if your answer is no, this is my first time participating on these events. Press 2 if yes, you have participated on one or a couple previously. And press 3, yes, I've participated on several events. Again, press 1 if this is your first time participating. Press 2 if you've been on one or a couple. And press 3 if you've participated on several events. Again, this is a live poll. Have you participated on previous Douglas County live town hall events? Press 1 for no, 2 for yes, 1 or a couple, and 3 for yes, I've participated on several events. Okay, at this point, I have a question for Dr. Douglas. Megan from Douglas County, you're live.
Hi, this is Megan. My question was about the swimming pools and when those would be reopened.
So Megan, thanks for that question. As Commissioner Layden said, everybody's eager, it's hot, it's summer, we want to get out. Those pools are going to be allowed to open as soon as the new set of public health orders go into effect, which we expect will take place tomorrow. There will be some parameters around spacing to be sure that they can be opened safely, but that will happen, should happen as early, Melissa, correct me if I'm misspeaking here, as early as Friday after those orders go into effect tomorrow. I'll use this as an opportunity to address Commissioner Layden's question about the safety of the pool environment. And chlorinated water is clearly not an environment in which the virus is going to survive. So being in the pool itself is not the concern. It's really being around other people around the pool's edge, and particularly touching surfaces that other people might have touched. And those will be the kind of things the guidelines will, I think, quite effectively address.
Okay, thank you so much. Oh, sorry.
Thank you, Dr. Douglas. At this point, we have an online question from Michelle. This one is for Commissioner Layden. What are the anticipated guidelines for large events like weddings? I'm a wedding planner, and venues in Douglas County are telling brides they can have up to 100 people, 28 square feet per person. What are the guidelines for these venues, and how can we ensure that they comply?
So wonderful question, and thank you for that. We certainly are getting a lot of inquiries, especially from brides-to-be about wedding venues, as well as a lot of questions about just large gatherings and venues in general. That's one of the reasons that this Board of County Commissioners, in partnership with Tri-County Health, has submitted a variance application through staff for large gatherings and event venues. So we have not yet received a response back from the state. We just submitted that, but based upon the recommendations from the stakeholders and Tri-County Health with input from our staff, the way it looks in our variance application is basically, first of all, amending that Public Health Order 2028, and then limiting the maximum number of participants to about 50% of the posted capacity code limit for each room in the venue, just to make sure that there's 28 square feet per person, not to exceed more than 175 people at any given time. Certainly recommendations around operating with current recommended state physical distancing practices, which would limit capacity further than the previously mentioned recommendations. Again, keeping families together at dining tables with at least 6 feet between the tables, separating chairs for any ceremony or programming by 6 feet between family groups, and then making sure that groups consist of members of a single household or groups that travel together. Again, a lot around entries and exits and making sure that there's designated areas to get through ingress and egress as possible, placing markings on floors to maintain at least 6 feet of distancing where lines might form, and then not allowing guests to congregate in the lobby area or gather in parking areas or other areas on the site. So those are just a few of the proposed guidelines and recommendations that the county has put forth to the state. I really hope the state can timely respond to this board with a variance, but time will tell. Thank you for that question.
Thank you, Commissioner Layden. Our next question comes from a live caller, Valerie in Franktown. This one will go to Commissioner Thomas. Valerie, you're live.
Thank you for taking my call or my question. The question I have is, how long is it taking for those variances to get approved?
So Valerie, that's the question we all wish we had the answer for. When we did the variance for Park Meadows Mall, it took us 10 days. When we did the variance request for churches, restaurants, and gyms, it took us 4 days. So we're hoping, because the state has already seen our suppression plan, that they know that we know what we're doing here, and our numbers are very low. So we certainly have our fingers crossed that we can get this done quickly. I will tell you that Tri-County Health, I know, has already started looking at what we submitted yesterday, which is a big step in the right direction. Thank you, Valerie.
Thank you.
Thank you, Commissioner Thomas. Our next question is an online question. I've seen information about drive-through testing in other locations. Is there somewhere I can get tested in Douglas County?
And this is Commissioner Partridge. I'll be happy to answer that. Okay. Commissioner Layden, take that one.
Certainly there are a number of testing sites, and we're encouraged by the news that where previously testing was somewhat limited, our understanding from Dr. Douglas and Tri-County Health, and I'm sure he'll correct me, is that if you need a test, you can get one. So my understanding is that virtually any normal healthcare facility where you might normally go for care may have some measure of test. And then, Dr. Douglas, I don't know if you had any additional comments about specific additional locations for citizens.
I think Dr. Douglas has left the call. Ms. Saeger, can you add anything to that?
I'll just add that Tri-County Health Department does have site resources for anyone seeking testing. If you go to tchd.org and check out our COVID updates, you'll see our testing page, and it outlines individual facilities both that are in Douglas County where you can seek testing. And I'll also highlight the testing facility in downtown Denver that's open to anyone. And I'll also mention that there's a testing event in Douglas County tomorrow in conjunction with Stride. You can find that information on our website too. So lots of places to get testing, and emphasizing if you have symptoms, go get testing. That is available now.
Thank you, Ms. Saeger.
Terry, I'd also like to add to that, and I'm trying to find it on our website. I'll pull it up, but just today is what we understand. We had our first drive-through testing site in Parker, and as we understand, it'll be up to 200 tests available there on a first-come, first-served basis. And so, if you are symptomatic, there is a site in Parker. And Commissioner Thomas, would you happen to know that address? I'm trying to pull it up on our website. I had it before and I cannot find it. Let me just ask if you have seen that. But there it is on the testing locations. And it should be on there. But as Commissioner Layden said, there's many locations at urgent cares, the hospitals, and Stride. And I don't see that address there, but it is over in Parker.
Okay, thank you. We're now about halfway through our live town hall discussion about your health and safety, safely reopening our local economy. We have many questions coming in, but we have time to hear from you. What do you want to ask the commissioners or Tri-County Health? Press *3 on your phone or send your question through the website at douglas.co.us/townhall. And remember, if your question isn't answered tonight, we invite you to go to douglas.co.us/Citizen Connect. That's CITIZENCONNECT to submit your question, and we will follow up with you directly. Okay, our next
Terry?
caller is, yes, go ahead.
I'm sorry, this is Commissioner Thomas. Commissioner Partridge was looking for a place called Stride in Parker, and it's just off of Cottonwood at 17866 Cottonwood Drive in Parker. So that's where Commissioner Partridge was explaining you could go get your COVID test in Douglas County. Thank you, Terry.
Okay. We'll take a live call from Dan in Highlands Ranch. Dan, this call is for Commissioner Layden.
Hi, thank you all for taking the question. I'm not sure if this call is for Commissioner Layden or if this is for the group as a whole. My question is, the various guidelines we've gotten, both from Tri-County and from the state, have done a really good job about being primarily of youth sports activities here, specifying what all the best practices are. They've been really vague about whether it's do one of these things and you'll be fine, do 3 of these things and you'll be fine. If under these new guidelines, the new recommended size is 25 players or less, do we still need to practice social distancing? can you help me sort of triangulate between, we know what all the best practices are, but it seems to be totally willy-nilly whether we do all of them or one of them, or just they're all kind of optional, but just do whatever you can.
To address
Okay,
that,
let's
and
that.
I'm happy to address that, and then maybe Tri-County can help with some additional information. But Dan, I think that's a really important question. You know, I'm a father of three, and two of them are in sports at all times, and the 2-year-old is probably headed that direction. And no doubt, heads are spinning with regards to all of the changes. It changes day by day, if not hour by hour at times. But what I would say is this: common sense is certainly helpful, in addition to just the great epidemiological data and information that we're consistently seeing. So there shouldn't be any new surprises with regard to washing your hands, social distancing, staying 6 feet apart. Certainly, being outdoors is something that we've heard from our experts is encouraged, although no definitive information there. And you know, it's challenging because this is new. I wouldn't say that anyone fully grasps what exactly is going to happen with this virus as we go forward. But what I will tell you is we are watching it day by day and looking at all of those key data points to make sure there is not a surge. And as we continue to see decreasing, flattening curves, more and more can be done. We just want to really make sure that our community is exercising as much caution and, again, that common sense, all really centered around the notion of personal responsibility. So when you're out there working with young athletes or with your kids, using good common sense and implementing the good practices that we're hearing from the experts, I think will save the day. But that's a really good question. I appreciate you raising that.
Thank you, Commissioner. The next question is an online question for Commissioner Partridge. Is the Douglas County government open, and what services are you providing right now?
Thank you for asking, and let you know Douglas County government has never closed. The majority of all county services has been open to the public one way or the other, whether it is online or dropping plans or any other type of material off at our drop boxes. But certainly online, we have over 60 different services online. And this week, we are certainly seeing more and more return back to our physical spaces here. So we're always open to the public. We were first in the county to do that. So yes, we are open and looking forward to serving you in all ways. So please don't hesitate to visit our website, www.douglas.co.us, if you have any questions, and you can access a phone number there if you would like to call us. But we are continuing to be open for business for you.
Thank you, Commissioner Partridge. Our next call is from Sam. Sam, you are live. This call is for Ms. Saeger from Tri-County Health. Sam, are you there?
Yeah, I was wondering when large gatherings like concerts and events will be able to happen again, I guess.
Yes, a really fantastic question. Thanks, Sam, for asking it. You know, we are talking about this gradual reopening, slowly moving into increased numbers of people in one area. The more folks that are in one space at a time, it's just significantly more likely for COVID to spread throughout that group of people. And so we're easing into that now. We've seen these gradual gatherings begin to happen, limited still, but we've seen increased gathering in places of worship, in restaurants. And what we're doing is we're monitoring that very closely to see what the data shows after these gradual reopenings, which will show us if we can take those next steps to more increased openings. I will say that under the most recent update to the Safer at Home order, these large gatherings are prohibited. Douglas County is seeking a county variance to increase the size of gatherings for events, but it's still very limited compared to what we're used to at a big Red Rocks concert or a Rockies game downtown. That is farther into the future, and we haven't quite gotten there yet, and we'll have to see how this gradual reopening impacts the data.
Thank you, Ms. Saeger. At this point, we'd like to run our second poll question. We'd like to make sure you stay informed about what's happening in Douglas County. And if you'd like to continue receiving information from the county, please press 1 on your phone now. Again, if you'd like to continue receiving information from the county, please press 1 on your phone now. All right. At this point, we have an online question from Brenda for Ms. Saeger. I own a business in Douglas County and have submitted a variance. How long will this process take? It's a 4,000 square foot salon, and we're working for a total of 10 people. Plan can still call for social distancing. When can she expect to hear back from the county?
So I will say I have good news because starting tomorrow, personal care services under the statewide order can provide services to 50 people maximum. That previous number was set at 10. There is a caveat. It's 50% of your capacity. And so if you have a smaller facility, you're going to want to have 50% of your fire code capacity. It looks like every other chair. We want to keep people farther apart. But for those very large facilities like you're describing, you can have up to 50 people starting tomorrow. And Douglas County is seeking variances in this area. The process is very far along and will be submitted at the end of this week, possibly tomorrow. And then the state has indicated that they're at about a week turnaround time on the variances. There are things that can make it take longer, like considerations of things that the state has not granted variances for before, but we're looking at about a week for feedback from the state on those requests.
Thank you, Ms. Saeger. Our next question is an online question for Commissioner Thomas. We have a primary election coming up this month. Are there any changes to how that will work due to COVID-19?
Thank you for that question about the primary election. The elections office certainly is doing different things than they have in the past because they have to keep everybody 6 feet apart. So the elections office certainly has made some changes. But as far as everyday voters, we already have the vote, the ability to vote by mail. And voting by mail in Colorado is a very safe process because of all the checks and balances that have been in place. So when you get your primary ballot in the mail next Wednesday or Thursday, go ahead, fill it out, put a stamp on it, stick it in a mailbox, or drive it to one of the many drop boxes around the county. And your vote is done and you're safe. There will be some in-person voting places available. And unless there's some reason you absolutely need to go in person to vote, it's much safer to do it by mail, both for the integrity of your ballot and for your personal safety. Thank you.
Thank you, Commissioner Thomas. At this point, we have an online question from Stephanie. I've heard that the virus will weaken with greater exposure to people. Is this true? Ms. Saeger, can you take that?
I'm not the best person to answer that question. Dr. Douglas had to step off the phone, but he would be the best person to answer that. If you can connect with me offline, I'd be happy to connect you with an answer to that.
Thank you very much to Ms. Saeger, Dr. Douglas, the Board of County Commissioners, and everyone who joined us tonight. You've asked so many thoughtful questions tonight, and we appreciate you taking the time out of your evening to be with us. We have time for a few more questions before we wrap up. I have a question from Rebecca online for Ms. Saeger. I understand that the gathering size for funerals has been increased to 50 people by the state. If you assisted with this limit increase, thank you. Based on the new variance request, are you going to try and increase that number more?
I appreciate the thanks. It's one of many things, and so I can't take credit for this specifically, but it is nice to know that the state is taking our feedback. So this is some of the things that the state is hearing from you all on this phone, from the businesses, from the commissioners, from us at the local public health agency, about what can realistically happen safely and where those gradual reopenings need to occur. So the statewide order does allow for 50 people. This is strictly in outdoor spaces at the cemetery. And so this is the brief service that you have with a small gathering in an outdoor place. We are exploring all areas where we can increase gatherings safely. We do have to maintain this very gradual reopening to be able to tell where spikes occurred, why, and address it so that we can continue opening. And so we are looking closely at where we can expand, but doing that slowly. So funerals was one of the first event spaces that was critical to the community to have access to. And so that was where that gradual reopening occurred. But keep an eye out for more.
Okay, our next question is from a live caller, Michael in Castle Rock. This one is for Ms. Saeger. Michael, you're live.
Yes, thank you very much for taking my question. It's a little bit offshoot of another question on large gatherings. This is actually typically a very small event. I'd like to try to put on a very small boutique art event, which typically doesn't have any more than 40, 50 people at any one time in the middle of the summer. And typically it's only maybe, 19, 20 tents, very, very small. Nothing compared to the Castle Rock Art Show. Can I continue to move forward on that, or do I need some kind of a variance or write-in for permission to have it done? Can you maybe just help me with that? I appreciate it.
Yeah, absolutely. Thank you so much for the question, Michael, and it's an important one. So I'll say just a few things briefly. Currently, that limit is 10 on all gatherings. There is concern in those spaces. How far apart can you maintain? Can you keep your social distance? It's a little different than a restaurant where you go to sit down and you sit still and you sit for a set period of time and you leave. And so there are a few concerns within that event space. But I will say that Douglas County is seeking a variance to increase the number of folks that can gather in these small settings, still a smaller number, not those big concerts, but how do we get a small event like yours to be able to continue? And that variance request has a variety of guidelines in place to run those events safely. And so we do expect that to be submitted this week, and the state's estimating that 1 week turnaround time. And so I'd suggest checking back with the county, with us at Tri-County, about any updates as it relates to that variance being accepted. But currently 10 people until that variance goes through.
Thank you, Ms. Saeger. Just a final reminder, if your question wasn't answered tonight, we encourage you to visit douglas.co.us/Citizen Connect. That's CITIZENCONNECT to submit your question, and we will respond. And be sure to join us Monday, June 15th for another COVID-19 and older adults live town hall. Due to the tremendous participation in last week's older adults event, we will dedicate a full 90 minutes answering questions about how older adults can stay healthy and safe as our economy reopens. Before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. Commissioner Partridge, let's hear from you first. Commissioner Partridge, are you there?
You think I would learn after 3 months. You hit the unmute button. Sorry about that. Thank you, everyone, for listening tonight, providing your questions, and hopefully we were able to answer that. But please contact us if you do have any other information. I do want to give a little correction. I was a little overzealous on the date of the drive-through testing site at Stride over in Parker. It is actually to start tomorrow, but it is where you have to be symptomatic. So if you show cough, fever, other flu-like symptoms that would show symptoms, you would be able to be tested. So I just want to correct that. But thank you all. We wish you to be staying well, staying healthy. And we also thank you, Douglas County residents, for your compliance, your courtesy, and understanding through these times. It's been difficult. There's still a lot of stress and strain. So please take care of yourself, but know that we are working very hard for you. We're working very hard with our partners in the municipalities and working with Tri-County Health, and hopefully you can see that there are positive changes. And we just want to thank you again for being part of this tonight.
Thank you, Commissioner Partridge. Commissioner Thomas, do you have any final remarks?
I do. I would like to say that, we've done a lot of these town halls, and after some of them, I've just felt really down. But this one, I feel energized. I think it's because we had a lot of good news to share with you, that we've had some successes getting things open. The governor opened some more things as of tomorrow. We've got more variances in the pipeline, and especially the numbers I told you about. We don't need to worry about 50 people going to the hospital. We've got like numbers of 0.3 and 0.7. So our numbers are very good. Our people are healthy. Douglas County is the healthiest county in the entire United States. So my hat's off to all of you. And I look forward to the next one of these, because I think we're going to have even more good news to share with all of you. So thank you for being a great resident here in Douglas County. Good night.
Thank you, Commissioner Thomas. Commissioner Layden, your final remarks.
Thank you so much. And thank you to my colleagues and certainly everyone that has called in tonight. A lot of really good questions, and I'm remiss that we weren't able to get to all of them. We did get a question about power in numbers, and if a lot of people have that is called herd immunity, when most of a population is immune to an infectious disease that is going to provide some protection to those that are not immune. So that's important. Certainly, we haven't seen the level of penetration to achieve that yet. But no, a lot of great information tonight and a lot of great good news. I would echo Commissioner Thomas that we're pleased that in this 9th town hall, things are looking up. So we just hope you have a wonderful and safe rest of your evening and week. And we look forward to talking with you next time.
Thank you, Commissioner Layden. On behalf of Douglas County and the Tri-County Health Department, thank you for sharing your time with us. We hope you will join us again for future town halls. Be well, be blessed, and good night.